Hey guys, Dr. Davin Lim, board certified dermatologist. Today we'll be talking about the absolutely biggest mistake I see when it comes to treating acne scars. So, as you know, part of what I do, and a lot of what I do, is actually treat scarring. The biggest mistake is this: patients need to control their acne. Now, hear me out for a tip. Let's say you're prone to scarring. I presume so because you're actually watching this video. So if you're prone to scarring, let's say you've got 100 acne scars and you want to treat those. If you have active acne, you gotta remember, you are in that subpopulation of patients which actually scar. So some people may have 10 acne lesions per month, but end up with no scarring. But you may have 5 acne lesions per month, but end up with lots of scarring over many years. How it works is this. Let's say you get 5 zits per month, yeah? Only 5, but then 2 scar. So basically, you only have 40% of your acne lesions that scar. Now, out of that 2, if you multiply that by 12, which is in a calendar year, you get 25, around 25 scars. Multiply that by 4, and next thing you know, you've got 100 scars that have accumulated over the 4 years. So this is why, if you do have acne scarring and active acne, you've got to make sure that your acne is under control. Remember, the time taken, the absolute predictive factor for scarring is the time taken to effective management. It's not the time taken to have a go at things, start a treatment, maybe go on Accutane, maybe go on the pill, maybe try a diet or a new skincare routine. That's not it, guys. It's the time that's taken to absolute control. When I mean absolute control, it's virtually getting very little, if not 0 zits. So that's super important because you have the propensity to scar. Your scarring basically is a genetically predetermined factor, which means your skin's immune system and the way of which you regenerate collagen and remodel scars is not quite normal. So that's unfortunate, but that's reality. You've got to get it under control. When I mean under control, what does that actually entail? It doesn't mean that you have to see a dermatologist, it doesn't mean you have to see a physician or skincare expert. There are many, many ways to treat your acne to make sure it's under control. So the first thing you could do is work on your diet. So we know that dietary inputs are massive in the context of acne management. So things like going on a low sugar diet, decreasing or eliminating dairy, supplementing your diet with something like zinc sulfate, and by all means, decreasing the amount of sugary foods and those with a glycemic index which is very high. So basically you want to eat foods which are not refined, healthy things. So generally speaking, if you find it in the packet, whether it be noodles or chocolate or chips, chances are it's pretty crap for your skin. So guys, diet is the first thing. Second thing what we need to do is look at skincare. Once again, you may not need to see a dermatologist. Remember, dermatologists, what we do is we prescribe drugs. We don't prescribe fairy dust, we prescribe drugs, whether it be hardcore Accutane or retinoids. But having said that, if you don't need to see us, that's one less person that you actually need to put on high-level drugs. What skincare can you use? So start with something simple, salicylic acid washes. You can buy that through a pharmacy. It doesn't cost you much at all. It's about less than $1 a week. So use something like salicylic acid. CeraVe makes a good one. La Roche-Posay, Effica, Micropeel makes a good one. So salicylic acid can help reduce the amount of blackheads, whiteheads, and acne lesions. Secondly, benzoyl peroxide or BPO. You don't have to buy Proactive. You don't have to buy a branded name. Something like a 2 to 5%. If you use that as a wash, maybe once or twice a day, can markedly help your acne lesions. Guys, in the US, you guys are so far ahead because you can get things like retinoids. So you can skip the retinol, and go right up to the topical vitamin A with the highest efficacy. So something like Adapalene, which is Differin. And for you guys, I guess in other countries, all I can say is be resourceful. So you can either get that through your general practitioner, but you can buy heaps of stuff online now. So if you can, things like Adapalene can help. If you can't get topical retinoids or prescription retinoids, the second best is retinol. So you can buy retinol from most skincare brands. Look for something between a 0.5 to 1%. And I keep saying formulations matter, right? So cheap is not often the best and expensive is not often the best, conversely. So see what you like, look at the reviews, get yourself some retinol, combine that with salicylic acid washes, combine that with benzoyl peroxide as tolerated. So just be careful with how you use things. Now, the fourth thing you could try is something like niacinamide. So if you have angry, active acne, niacinamide can make a world of difference because it can calm down your acne, reduces inflammation, and importantly, establishes the skin barrier function. So after all that, if you still have acne, what can you do? Well, you can visit a spa, but chances are, if you've tried all that, maybe a spa can give you for example, phototherapy, whether it be blue light or red light, or they can add chemical peels, whether it be higher strength salicylic acid between 10 to 30%, which is a beta hydroxy acid, and alpha hydroxy acid, something like glycolic acid or even lactic acid, or they can give you a retinol peel. When you see a dermatologist, generally speaking, our peels are a little bit higher. So things like salicylic acid 30%, retinoic acid between 1 to 7%, and glycolic acid, lactic acid in a higher concentration. So these are all little things that you can do to help control your acne, eliminate your acne, and hence prepare you for scar revision. So guys, just to summarize, the most important thing, like I said, it's not the piece of equipment that counts for scar revision. It's not really the doctor as well. I mean, it does make a little bit of difference to have experience, but the most predictive factors is if you can reduce your inflammation. How I tell patients is this: if you're trying to build muscle, for example, or trying to work out and get your biceps really huge, you're not going to get anywhere. You're not going to build muscle if you're going to have a muscle tear, because you're going to have inflammation, right? So if you strain your tendon, strain your muscle, and it's inflamed, much like how your skin is inflamed because of acne, you're never going to build collagen. Similarly, you're never going to build muscle because things are inflamed. You got to calm down the inflammation so that it gives your body time for it to heal. So guys, that's the biggest hint I can give you in the context of scar revision. From there on, if your doctor or if your physician, your dermatologist, plastic surgeon uses the appropriate treatment methods, once again, it's the method, it's not the piece of equipment, it's the method, whether it be subcision, whether it be filler, whether it be TCA peel or TCA cross, or whether it be lasers or surgical excision. If they can pair that particular treatment to your type of scarring, generally speaking, the results are very predictable. So I understand your frustrations because some of you guys would have tried many things over the years, but like I said, the first step, the very first step, get your acne under control, and from there on, everything flows. Guys, I hope you liked that video. It's a short one, and I think it's a very important one. For more, follow me on Instagram, either 101.skin or Dr. Davin Lim. I'll see you probably same place, same time next week. Bye for now.